Hello, I'm Sangeeta Mookherji, and I'm going to be your instructor for this course, Program Evaluation. Let me tell you a little bit about myself first. I have a master's in health science from Johns Hopkins School of Public Health in international health, and I have a PhD, also from Hopkins, in health economics. Prior to that, I studied comparative literature at the undergraduate level, and that means that I speak 3 languages fairly well, 2 adequately, and 1 quite badly. But you should also know that I'm not a career academic. I spent 15 years in public health practice. When I worked in about 18 countries, I actually lived in 5 of those countries, and I worked with public health programs, most often advising them on evaluation activities or conducting evaluations on their behalf. Through all this experience, I've really come to believe that without good evaluations, we're simply not going to make the progress in public health that we desire. We are not going to learn how to better control disease. We are not going to learn how to prevent the conditions that we know how to prevent until we generate better evidence from good evaluations. And that's what you're going to learn to do here in this course. You're going to learn to do how to do good evaluations. What makes a good evaluation? And to do that, you're going to bring a lot of skills that you've learned in the course of your public health education and that you will continue to learn. You're going to need to know about epidemiology, biostatistics, social and behavioral theory, qualitative and quantitative research methods. As an evaluator, you're going to need to bring all of those and apply them to a particular evaluation question. And that's what we're also going to learn how to do here in this course. I think that no matter what area of public health you end up working in, you're going to need to know something about evaluation. If you're a policymaker or a program implementer, I guarantee you're going to want to know whether something is working or not. And if you're going to know something about that, you're going to need to do a good evaluation. You're either going to need to know how to do it yourself, or you're going to need to know whether the team that you've hired is proposing a good evaluation or not. So the skills that you learn in this course, the knowledge that you'll get from this course will help you in either of those endeavors. I happen to love evaluation. I find that no matter what, it's a fantastic challenge. Every single evaluation I do is different. Every single evaluation requires a different set of skills. It requires me to be critically thinking all the time. I love the newness of it, the continual challenge, and I love the idea that I'm working really hard to generate evidence that will help us make progress in public health, in combating disease and preventing disease and giving people a better quality of life.